What is the way that all of this came about? How this bill was crafted, this draft was crafted, and the response from the Republican caucus? What does that say about the state of the Republican Party right now?
I mean, we had a piece this week in the magazine talking about how divided the Republican Party is as ever in terms of getting their ducks in a row. I think with healthcare, it's been particularly interesting in seeing the reception. This is a difficult package to sell. You already see the Democratic lines out there. And of course, the lines that a lot of people are talking about is this is effectively a massive wealth transfer, real big tax break for the rich. You're basically putting potentially the most disadvantaged, the poorest people in the country at risk for less affordable health care, no health care. And also, you're also threatening to take benefits away from people we saw yesterday in Capitol Hill, people in wheelchairs up there on the floor. The optics of this aren't great. The underlying message isn't great. So much of it was drafted in secrecy. This is a really hard bill to take back to districts, even Republican districts, given the issues involved, particularly on what Democrats are going to keep harping on. This is a tax break for the rich.
Zach Tracer, compare this bill, this draft that we got yesterday, to what we saw from the House of Representatives. How different are these two pieces of legislation?
You know, broad strokes, as Megan pointed out, these are pretty similar bills. You know, a big tax cut. The tax cuts are almost exactly the same. There are some changes, I think, that will help people afford health insurance, at least in the near term, over the next few years. Longer term, you know, talking about 2024, 2025, you know, some pretty steep cuts to Medicaid that are coming. But, you know, that's 2025, and we're sitting here in 2017. So, you know, that's quite a ways off.
Sahil, let me ask you about how the Senate Majority Leader is going to embrace this piece of legislation. Again, we just have a draft now, but he's going to want to be sure, I assume, that this is going to get the votes it needs to pass. What's he going to be doing over the weekend and into next week?
McConnell's going to have a strategy before he brings this to the floor. Now, the process of voting on this is an interesting one. It's called the Vote-A-Rama. They're unlimited amendments. Anybody can offer whatever amendments they want. And Democrats will be sure to offer a lot of amendments designed to throw sand in the gears. What McConnell needs to do is find a way to get 50 out of his 52 members on board. That is going to be a huge struggle. Excuse me. You've got 4 members on the right who have already come out and said they cannot vote for this bill as it stands. You have Susan Collins and Lisa Murkowski complaining about the fact that it defunds Planned Parenthood. You have senators from Medicaid expansion states like Shelley Moore Capito and Rob Portman who are not happy with the depth of these cuts and the fact that they have an opioid epidemic and they want some money for that. This is the kind of thing that McConnell needs to find a way to balance out. And I think you'd expect him to spend the weekend probably on the phone to his members, hearing from their staffers about what they want or hearing from them directly and seeing if he can do it. He's got to meet this deficit reduction reconciliation target at least as much as the House bill to get it through simply under the rules. So it's a very tough balancing act.